Hello everyone, my name is Dr. Cristina Cubrelo Santos. I'm a doctor of acupuncture, and in this video I will be teaching you how to perform cupping and sliding cupping on a partner at home. I'll be utilizing Korean cups, which are suction based, unlike the traditional Chinese medicine cups which use fire suction. I feel that in my practice and as well as for home use, it is much easier to utilize Korean cupping, and it is easily purchased online. So I will link where you can buy it for yourself below this video. My cupping set is AG Professional Cupping Set. It comes with a set of cups. It comes with a suction gun, as we call it. And it also comes with an extension cord. And an extension cord is used for those hard to reach areas if you're maybe trying to do it on yourself at home, which I have done a lot of the times and have guided my patients and clients to do the same, especially if they don't have someone at home that can do it for them. One thing to know about cupping is that if you're on blood thinners, if your partner has diabetes, please do not attempt to do that at home on your own. I would always consult a professional. However, this is for healthy adult individuals. You can do this on children, which I've done. However, I am a licensed practitioner, so I wouldn't recommend experimenting on your own. And another thing with cupping, I like to use a little bit of oil. Creams generally tend to absorb much faster into the body, and especially for the technique that I'll be showing you as well, which is sliding cupping, it's not preferred. So I generally use coconut oil. This one is infused with hibiscus. You can use other oils. Just make sure to ask your partner if they have any allergies to any particular oils or scents. With that, I will have a demo person today, and I will show you the neck and shoulder protocol. A lot of people have tension in their neck and shoulders, especially spending too much time using computers and our handheld devices. All right, welcome back. So as I said, I have my partner here who will willingly participate in this demonstration. He generally suffers from a little bit of shoulder pain, and for a lot of people there's shoulder tension and neck tension, as I mentioned previously. So let's get right into it. I will use the coconut oil infused with hibiscus, so it smells really good and it glides on the skin perfectly. A little bit goes a long way, so just a few drops, maybe about quarter size. Rub it between your hands lightly and then apply it on their skin directly. You do not have to be a pro as far as the application of oil. Just make sure that you have enough lubrication so the cups can glide with ease once I show you how to do that. I'll put a little bit more. If someone has more of a dry skin, or especially in the summer months, there is a tendency for the oil to absorb much faster. Otherwise, make an accurate assessment and see that there is some oil there and it's not fully absorbed into the skin before you start sliding the cups. A little bit of massage just to stimulate the area. And the first method I will show you is the stationary cupping method. As I showed you previously, the cups come in different sizes. For the neck, we will use a much smaller cup. For a bigger area, such as the shoulder and the back, we are using bigger cups. So I will start with the neck. And when it comes to amount of pressure that you'll apply, always communicate with your partner. In the beginning, start with 1 or 2 pumps, and then as they get used to the sensation, you can add on more suction. I will start at the base of the skull, right at the top of the neck. So I'll position the cup right at the top of the neck. I'll place the suction gun right on that little knob, and I'll do 1 pump. Is that okay? And then I'll do 1 more pump. Let me know if that's okay. Good. And as you see, the cup is securely standing. In the beginning, as you work on your technique, the suction may lose its strength and the cup may fall. So just try a couple of times until you get accustomed to working with this method. I will then place the next cup a little bit lower. Make sure that the cups are not too close to each other, because then they will lose suction and will fall off. So you do need some spacing between the cups themselves. Is this okay? I'll do 1 more pump. And as you see, the top cup stayed on, which means that the distance between these 2 cups is right. To go to the trap, the upper trapezius area, I will use a bigger cup. So as I mentioned already, cups come in different sizes, and depending on the size of your partner, you will also need to make an accurate assessment of which size of the cup you will need. One thing to note is when you're placing the cup, make sure it's not at the edge of the muscle. So when you're tracing the body, you can see that each muscle has a little bit of a border, right, where it kind of rolls over to the other portion of the body. So make sure that you're not at the edge of the muscle, because again, you won't be able to keep the suction of the cup. So I'm going to work a little bit more posteriorly on the trap. 1 pump, 2 pumps. And again, some people might have higher pain tolerance. So ask them if they want more suction, if they want less suction. If for whatever reason they would like less suction, you will hold on to the knob and pull it off like that. So it creates a little sound where the air is coming off, okay? So I will try that again with just 1 suction, because like I said, he does have some tension, and doing too much of a suction can be painful. Is that okay? All right. Now, when working with the shoulder, I like to surround the shoulder girdle, because there are 4 main rotator cuff muscles which stabilize the shoulder joint. And obviously, as human beings, we use the rotator cuff a lot. So I like to surround the entire shoulder just to be able to attack all of the muscles that could possibly be involved in what's causing the pain. So the trap is also covering the supraspinatus, which lies beneath it. Below this area is the infraspinatus muscle, which is another rotator cuff muscle. So I will go below the spine of the scapula and try not to go onto the bony portions of the body. So you can trace it with your fingers and feel where the spine of the scapula is. And if you go further forward, you will see that there is a bony little knob called the acromion process. So never place the cups over the bones themselves. Is that okay? Do you want more or stay like this? Okay. That's okay? Too much? Okay. Now I'm going to go a little bit further laterally to the side, just because these muscles do come forward with the attachments. So I'm going more towards the deltoid area. If you could just show your body a little bit more this way. Perfect. Is this okay? Can I do a little more or keep it like this? A little more. And as you're navigating the pumping with this tool, you can also do half a pump. So strong is going to give a lot of suction, and somewhere lighter touch will give half a pump. So play around with that and always communicate with your partner. If you see them wincing, that can also be your cue, but verbal cues are way better than you trying to figure out what's going on. All right. And I will also go into the area of the rhomboids, because the rhomboids draw the shoulder blades closer together. And these muscles also have a tendency to get very tight and painful as well. So I'll put another cup right there. You can also ask them where they feel the pain. Oh, this one farted and fell off. So sometimes that happens when your partner moves their body and shifts, and that's not a big deal. You can ask if they want it back or if they need a little break. Do you need a little break from that cup or keep it back on? Okay. So I'm going to reapply the cup on the trap. A little more. That's it. Okay, so as you see, this tightness with one suction is plenty for this area of the body. And now back to the rhomboid. Just going to move this way so you can see a little bit better. Is this okay? Great. And voila, it looks so pretty. Also, what I like to do is have the person move the body part where the cups are. This, of course, can cause some of the cups to fall off, so encourage gentle movement. When working with the trap and the neck, we generally want to use some circular movement or gentle extension or lateral flexion of the neck. So I'll ask my partner to gently lift the shoulder up towards his ears and slightly back and then down, and he'll do that 10 times. I will move this cup slightly away from the edge of the muscle because it seems like I was right on the border and the suction keeps releasing. Encourage your partner to take some deep breaths because this work can be quite intense. As you see, the cups are already beneath them, the skin is already changing color. So for my partner, it's becoming more of a purplish hue. Something to note that the differences in color of the skin can give you an idea of what's going on in the body. So if it's more of a redness, bright redness, it's more of an inflammation of the muscle. If it's more of a purplish, darker hue, that can indicate that in that particular muscle or area of the body, the blood is not moving as freely, and that's where a lot of people get muscle knots. So I would suggest that you keep the cups on for no longer than 10 to 15 minutes. And for the sake of this demonstration, I will take the cups off at this point, okay? So I'll first remove the one from the neck. And then the second one, the one from the trap. And I will ask my partner to just come a little closer so you can see the differences in the colors of the cups. The one that is the darkest is the one closer to the edge of the shoulder and the neck, which corresponds to the levator scapulae muscle, which elevates or lifts the shoulder blade. So a lot of us hold tension there, obviously the trapezius muscle, and then right on the posterior deltoid and infraspinatus, and there is color change in the rhomboid area as well. In the next video, I will show you how to apply a sliding cupping technique on the same body part. I will use the other side of my partner.